Good afternoon, everyone. So I've been allotted this topic as inflammation and repair. I'll be covering this topic in 2 lectures. Probably I'll be covering acute inflammation today, and the other one I'll be covering in the next lecture. So first of all, congrats everyone for passing out this year, this harsh year, which has been very difficult for all of us. And finally, we are here, like in the end of the day, and I know it's very difficult to attend the last day of the lecture, last day of the year. So first, definition. What is the definition of inflammation? Inflammation is a response of vascularized tissue that delivers leukocytes and molecules of host defense from circulation to the site of infection and cell damage in order to eliminate the offending agents. So this big sentence, what does the simplified version of this means? This big sentence, it simply means it's a process in which your vessels, your vascularized tissue, there's a vessels blood flow to the organs, in which this inflammatory cells will leave from blood vessels to the tissues, and it will deliver its leukocytes. Leukocytes means your neutrophils, eosinophils, basophils, these all kind of things are come in the leukocyte series, to the host and molecules of host defense from the circulation to the site of infection. It means there is an infection in your tissue. All these inflammatory molecules will go to that tissue, and it will try to control this inflammation, and it will try to eliminate these offending agents. In this, let's go for the brief introduction of this acute. It is actually of 2 types: acute and chronic inflammation. Acute inflammation is one which occurs immediately, like within few minutes to few hours. But chronic inflammation, it takes time to generate, and it will continue for a longer period, like days or months, like this it will continue. So, acute inflammation, the initial rapid response to infection and tissue damage is called acute inflammation. So, it typically develops within minutes or hours, and is of short duration of time, and lasting for just for few hours or few days. That's it. And its main characteristic is exudation of fluid and plasma proteins. That is called edema. Like from your vessels, a fluid and these molecules go into a tissue. It will create some like boggy, like fluid area. It will be called as edema. So it will cause an edema and emigration of leukocytes, predominantly neutrophils, also call it polymorph. So there are 2 kinds of leukocytes, like polymorph and monomorph. Polymorph are the one which are like your neutrophils, basophils, and eosinophils. These 3 are the polymorph, and monomorph are the one monocytes, and the monomorphs are the one like monocytes and lymphocytes. These are the monomorphs. So when acute inflammation achieves its desired goal, that is elimination of the offender, then the reaction will subside itself slowly. And acute inflammation is the one of the reaction of the type of host defense that is innate immunity. Like it comes from your birth itself. Like since your birth itself, this acute inflammation is the one which is present in you. Like even if a child is born and is like having some infection or somewhere, this acute inflammation will take over to that place. Chronic inflammation, if acute inflammation fails to clear the stimulus, and the reaction progresses to protracted phase, that is called chronic inflammation. Like if acute inflammation is not able to control the infection or anything, then it will lead to chronic inflammation. So chronic inflammation is of longer duration and is associated with more tissue destruction, the presence of lymphocytes and macrophages, the proliferation of blood vessels, and the deposition of connective tissue. So actually, the chronic inflammation is of more kind of tissue destructive kind of, but acute inflammation is just for the control of infection and this thing. So complications arises more in chronic inflammation. So chronic inflammation is more prominent in reactions of adaptive immunity. Like adaptive immunity is the one which you acquire during your lifetime. So it's not present at the time of birth. So now let's come to features of acute and chronic inflammation. So acute, first see the onset. In acute it is minutes to hours, but in chronic it is slow and it takes days to generate. And cellular infiltrates mainly neutrophils in acute inflammation, but in chronic monocyte, macrophage or lymphocytes, and lymphocytes are the one. Then tissue injury and fibrosis, usually mild to self-limited, it's not much, but it is in chronic it is severe and progressive. It will continue for a very long period and it's very severe. And local and systemic signs. In acute inflammation, these features are very prominent, like rubor, dolor, color, and like pain, like your pain, redness, and warmth that you feel in the inflammation area. It is more in this acute inflammation, but it is less in chronic inflammation. So, what are the steps in inflammation? First is recognition. Then comes the recruitment of leukocyte and plasma proteins. Then removal, regulation, and then repair. So recognition, as you can see, the microbes, when they enter through this epithelium, it will be taken up by this macrophage and these cells which are present in the tissues. So it is the recognition. Then recruitment. What is the recruitment of leukocyte and plasma proteins? When these molecules, when they detect this infection, it will create some mediators, like it will create some cytokines or some kind of inflammatory molecules which will attract these lymphocytes and these leukocytes and plasma proteins in this area. So monocytes and granulocytes, these things will come to the site of tissue injury. And then after the injuries are like controlled, then it will be removal of this, whatever these molecules have come, it will be taken up by macrophage and these things, they will remove this, all the destruction and everything. And then regulation, like after the clearing of this thing, these molecules have to be it will be regulated, like it will be continuing, means it will be destructed by itself, called as apoptosis. Apoptosis in this, it is a programmed cell death in which the body itself controls the cell death. So, and then repair. Repair is by fibroblast and all, it will be like putting up some fibroblast or some granules, it will come and it will subside the inflammation. And then what are harmful effects of inflammation? Protective inflammatory reactions to infection are often accompanied by local tissue damage and its associated signs and symptoms like pain and functional impairment. Typically, however, these harmful consequences are self-limited. In contrast, there are many diseases in which the inflammatory reaction is misdirected. Like your tissue, like your immune system of the body itself will recognize your tissue as a foreign and it will act against it. So it will cause autoimmune diseases and then occurs against normally harmless environmental substances like allergies. Sometimes you develop allergies and all. In that also your body immune system will attack it will cause allergic reactions and these things like hypersensitivity reactions it will cause. So there are some list of diseases which is caused by the inflammation, like ARDS, it is caused by neutrophils. And then asthma, it's generally eosinophils, which is elevated in the body because it is the responsible molecule for the injury. Then glomerulonephritis, antibodies and complement, it will act against your kidney, tubules and everything. So it will cause your damage to the kidney. And septic shock, like some cytokines and these things, cytokines are released in the body, which will lead to the shock in the patient. Then what are the chronic disorders like arthritis? In arthritis, mostly lymphocytes, macrophages, and there are studies going on about the antibodies, which is not very sure, like antibodies are acting the role or not. But there is some studies which suggest that antibodies also take part in this arthritis-like condition, but mostly it is lymphocytes and macrophages. And again, in chronic inflammation, asthma can also be there. Like patient can develop asthma, they develop and they continue for the whole life. So this eosinophils are the one responsible. And then in atherosclerosis is a condition in which there is some micro injury in the vessel walls, which leads to the deposition of your cholesterol and your fat bodies and everything, like inflammatory, even this fibroblasts and everything will be deposited, which leads to the occlusion of the vessel. Like there is narrowing of the lumen, which will lead to some like cardiac arrest or something, heart attack, they say myocardial infarction. It used to cause this atherosclerosis. And pulmonary fibrosis is also this macrophages and fibroblasts. So what are cardinal signs of inflammation that I was talking about? That is rubor, tumor, calor, dolor, and functio laesa. This fifth one was introduced later in the 19th century, but this 4 symptoms was previously it was described during the first century, like during the first AD that was described, and this was included in this 19th century. So rubor means redness, tumor means there is a swelling. Calor means increase in the temperature of the area. Dolor means pain. Dolor means there is a pain in the area, and functional LSR means if there is inflammation in any kind of a part of the body or anywhere, it will hamper its function. So that is functional SR. So what are the causes of inflammation? So it can be infection, which can be viral, fungal, parasite, anything. Then tissue necrosis. It can be due to ischemia, trauma, physical or chemical injury, which causes inflammation. Then foreign bodies, like exogenous, like after the fracture of the bones, we used to put the splinters, and if any open fracture is there, then there's dirt which is exposed to the bones and all. It will cause this foreign body reactions. And then even if after the non-dissolvable sutures, if we put the suture in the body, without the dissolvable, there are some sutures which you can put in the inside the body and it will dissolve within few days. There are different sutures which have time of dissolving. So if these silk is the one which never dissolves. If that is put inside the body, in the organs or wherever it's inside, then it will cause this foreign body reactions. Then endogenous, like urate crystals that is found in gout, and the cholesterol crystals in the atherosclerosis, lipids in obesity associated metabolic syndrome. And there are some immune reactions. I told you about this autoimmune diseases or allergy which causes inflammation. So what is the first step in the inflammation? That is the recognition of microbes or damaged cells. So there are receptors like toll-like receptor, lectin receptors, then Rig-like receptors, and then these three receptors are there, which are actually responsible for detecting this organism, and then they will represent these molecules to the nucleosome complex, which will further take over the destruction of this organisms and everything. So innate immunity recognizes foreign antigens like microbes through receptors on the plasma membrane of epithelial cells, like this toll-like receptor, lecithin, these are there. So these products will come and join to these receptors and they will recognize it. And then they will proceed further for the inflammasome or something to destroy this organism. Now there is second is recognition of tissue damage is through factors that are released after damage, such as uric acid, release after DNA breakdown, ATP due to mitochondrial damage. Like after mitochondria is damaged, there are stored ATP inside it. So it will be released outside. So that can be detected, and these are such products which activate the what are called inflammasomes, like cytosolic complexes. Inflammasomes that releases interleukin-1. This is thought to be responsible for gout and atherosclerosis. Even interleukin-1 is the one responsible for fever, which causes fever in the body. So we'll go to acute inflammation. This is the things we are going to study in the further this class. That is steps: blood vessel reactions, then leukocyte recruitment, clearing of offending agents, then termination of response, mediators of acute inflammation, morphological patterns, how they look, and then outcomes. What are the outcomes of acute inflammation? Like after acute inflammation, where can this inflammation can go? Either it can resolve, it can convert to a chronic phase. We'll see. So steps in acute inflammation will go to blood vessel reactions. So the vascular reaction of acute inflammation consists of change in the flow of blood and changes in the permeability of vessels. Like the blood flow and the permeability will vary. It will change according to if the inflammation is there. Both designed to maximize the movement of plasma protein and leukocyte out of the circulation into the site of infection or injury. Like both are designed in such a way that it will lead to the movement of leukocytes as well as plasma proteins to the site of infection. Now, how this happens? Let's see. There is a change in the flow of blood. Like there is a vasodilation. There are some cytokines, and these things are released from the body, which causes vasodilation of the vessels, which actually increases the it causes stasis, it decreases the speed of the blood flow, so the leukocytes and everything gets time to move out of the vessels. So in this way it will decrease the velocity of the blood passing through the vessels. So it causes stasis and accumulation of leukocytes, principally neutrophils. As it is acute inflammation, so mostly it will be neutrophils which will be coming out from the vessel. So now there is increased vascular permeability. there will be increased permeability. So how does this occur? Like endothelial contraction. There will be contraction in the endothelial cells, which will lead to passing up. There will be a small like pore will be created, which will lead to this movement of this lymphocytes to this things, leukocytes outside the tissue to the site of wherever it is required. Then it can be also increased by endothelial injury, like there are some like collagenase or something they'll be releasing that leads to damage of the vessel lining, so it will make it space to go outside, and this transcytosis. Now, leukocyte recruitment at the site of injury. So how this leukocyte goes at the site of injury? There are like 3 steps. Like in the lumen, in the blood vessel, it will cause margination, rolling and adhesion to endothelium. Then it will cause migration from the endothelium to vessel wall. And then it will go towards the site of injury, chemotactic stimulus, like margination. In this, the peripheral position means generally the blood flow is like RBCs, that means mostly the red cells will be flowing in the middle of the, like this is the vessel, like this is the vessel, red cells will be flowing in the middle and surrounded by WBCs, like it is not completely marginated, it's somewhat in the middle and the flow is like very fast, so it doesn't take time to get into the near the endothelium. So generally the blood flow usually occurs in the middle, but and these leukocytes, these lymphocytes also they move in the middle, but due to this vasodilation, this actually they move towards the periphery. They come towards this periphery side, and that is called as margination. And this rolling, it occurs due to this P-selectins in the endothelium, E-selectins in the endothelium. These P-selectins are also present in platelets, and there is L-selectins in these leukocytes, which actually cause this. L-selectins usually binds with this E-selectins. And then there is Cialis X modified glycoprotein. It is actually the receptor for this. This is the receptor, and this is the protein where it will bind. So actually, what this do is like when the flow is very fast, then this rolling actually they will go and combine. They will go and bind with these receptors, and it will lead to slow down the process of this rolling, like this movement, and it will further give time for the leukocytes to slow down and move out of the vessels, like adhesion. Then finally cells come rest at some point and they adhere firmly, like integrins. These are the ones which are responsible for firm adhesion. Like I told, this Cialis X modified glycoprotein and this E-selectin and P-selectin, these are the one which is very light bounding. It is usually for decreasing the speed of these leukocytes. But integrins are the one which are responsible for stern binding. And then this migration across the endothelium and vessel wall. Actually, these neutrophils and all, they releases some collagenase kind of this materials which actually dissolves this membrane, like endothelium, which leads to passing up by, they'll create a small pore and it will move outside. It will move outside of this endothelium. That is called as diapedesis. So now, since these neutrophils are out of the vessel, now they'll go to this area of this injury. So it will start moving. There are some cytokines which are released by these things. So this macrophages and all at the site of like, I'll show you a better picture. Like this is the complete thing which is happening. Like this is the one leukocyte which is coming, and this is margination moving towards the vessel wall, and then they are rolling towards this by the selectins, and then after they combine with this integrins, they'll adhere firmly. Then there is diapedesis. They'll move out, and then they will come to the site of inflammation. Like this is the microbes which are creating some havoc in the tissues, and these macrophages, they come and they like monocytes, when they come out of the tissue and goes into tissue, that is called as macrophage. Like they change its form, they become bigger, and they are like activated ones. So they are the one which is responsible for this first one to release this cytokines and all. That will control they will recruit more of the neutrophils and all leukocytes for the further control of infection. So this macrophages, they'll release some cytokines, TNF and interleukin, which will actually this P-selectin, E-selectin, generally they are hidden. But due to the cytokines, they will express themselves through this endothelium, which will lead to this margination and this rolling phenomena, and this integrase will combine. After this neutrophils, after diapetesis, they'll come to this area where this inflammation is going on, and they will try to control the infection, and they'll try to kill the microbes and whatever things which are causing the issues of the inflammation. Like now, we'll come to phagocytosis and killing of the offending agents. Like it involves 3 sequential steps, like recognition and attachment of the particle to be ingested by the leukocyte. There are some receptors which actually they'll come and they'll express themselves. Then this bacteria and all, they will adhere to this thing like leukocyte and all, and it will try to enter. It will enter inside, and they will form like this phagosome, and it will combine with lysosome. So lysosome are the one which are having like lytic materials. Lytic means it has the destructive materials. So when they combine together, then this lysosome actually are the one which will kill these organisms. So formation of lysosomes, and this phagosome will combine. It will lead to fusion and form phagolysosomes. Then these microbes will be destructed, and this microbes will be released outside as a debris, and this macrophages and all other things will eat it up. So it happens like recognition and attachment, then engulfment, like eating up, and then killing and degradation. It is other ingested material mostly by reactive oxygen species and other lysosomal enzymes. Then phagocytosis and killing of offending agents. Like neutrophilic lysosomes contain 2 types of granules, specific and the larger eosinophilic granules. Specific is also called as, smaller one is secondary granules, which contains lysozyme, collagenase, gelatinase, lactoferrin, this plasminogen activator, histamine, alkaline phosphatase. The larger eosinophilic granules are the one which contains myeloperoxidase, which is bactericidal, and acid hydrolysis, and a variety of neutral proteases. So acid proteases degrade bacteria and debris. Neutral proteases are capable of degrading various extracellular components such as collagen, basement membrane, elastin fibers, and cartilage. Now, how to terminate the response? Like after this killing and everything is done, then how to macrophages and like this neutrophils and all are there, then how to like stop it from this destruction? Like removal of mediators of inflammation. So mediators of inflammation are produced in rapid bursts, like it is produced suddenly and only as long as the stimulus presents. Like I told you that the cytokines are the one which are actually causing the recruitment of the neutrophils. So the cytokines still, when it is there, this neutrophils will keep coming and it will try to destroy. And they have a very short life. After there is no cytokines available, so this they'll just kill by apoptosis, and they will subside itself, and it will be degraded. And short half-life of the inflammatory cell. Inflammatory cells die by apoptosis within a few hours after leaving the blood. Like they have very short life and they will be killed by apoptosis. Like it is self-killing. Like apoptosis is the one means a body cell, like its function is done. It will have the mechanism of killing itself. Like it will not continue to live further. It will kill by itself. And then this stop signals. This include anti-inflammatory cytokines, including transforming growth factor beta and interleukin 10 from macrophages and other cells. Like these are the ones which is giving negative feedback to the cells which are to down-regulate their process. Now leukocyte-mediated tissue injury, like collateral damage as a part of normal defense reaction against infectious microbes. When agent tissues suffer collateral damage, like it's not that organism will only be killed, but surrounding tissues and all, those will also be suffering some injuries, like because of release of the chemicals and all, they will eventually have to suffer. And it is difficult to eradicate infection. In some infections that are difficult to eradicate, such as TB and certain viral diseases, the prolonged host response contributes more to the pathology than the microbe itself. Like this viral infection and TB, they have in that it's not very the response is not microbes are very less damaged, but the body tissues are more damaged than the microbes. So that leads to chronic infections. later in the TB and all, we see that it's like a very long duration history patient will give. And also in this autoimmunity, when the inflammatory response is inappropriately directed towards host tissues, as in certain autoimmune diseases, like an allergy when the host reacts excessively against usually harmless environmental substances, as in allergic diseases, including asthma. Mediators of acute inflammation. The mediators of acute inflammation are the substances that initiate and regulate inflammatory reactions. Some chief mediators and their action is summarized below. We will discuss them. We'll discuss further details like vasoactive amines, mainly histamine and serotonins. These are the ones which are actually most important in this acute inflammation. Then arachidonic acid metabolism, like prostaglandins and leukotrienes. These are also produced by the body with this pathway. This arachidonic acid, this metabolism it actually occurs. Several forms exist involved in the vascular reaction like leukocytes, chemotaxis, and other reactions of inflammation, antagonized by lipoxins. Then cytokines. These are proteins produced by many cell types, usually act as at a short range, mediate multiple effects mainly in leukocyte recruitment and migration. Principal ones in the acute inflammation is TNF and interleukin-1s and chemokines. So then what is a complement system proteins? These are also involved in this acute inflammation, like activation of complement system by microbes or antibodies leads to generation of multiple breakdown products which are responsible for leukocyte chemotaxis, opsonization and phagocytosis of microbes and other particles and cell killing. Like complement proteins are the ones which are present in our body, like in our vessels and all, generally they are present, and they need some like base to react. Like there are some like IgM, IgG, these are the immunoglobulins which are actually one responsible for activating of these complement systems. When they are activated synergistically, they will affect the like killing. It will help in this killing of the organisms. And then kinins. Kinins are the one produced by proteolytic cleavage of precursors like which mediate vascular reaction and pains. Like kinins are the one which causes mostly pains. So vasoactive amines like histamine and serotonin. What are the source of histamine? They are mostly from the mast cells which are normally present in connective tissue adjacent to blood vessels. Now released by mast cells in response to variety of stimuli such as heat and cold trauma, hypersensitivity and anaphylotoxins like C3A and C5A. These are the anaphylotoxins which are responsible for mast cell secretions, like histamines, they are secreted by mast cells. This histamine causes dilation of arterioles and increases the permeability of venules. These vasoactive amines are mediated mainly via binding to receptors called as H1 receptors on microvascular endothelial cells. It is caused by H1 receptors which are present in endothelial cells. This histamine will go and bind it, and it will cause the vasodilation, like it causes the relaxation of the vessels. Now serotonin is also called as 5-hydroxytryptamine. It is preformed vasoactive mediator present in platelets and certain neuroendocrine cells. It is a vasoconstrictor. Like histamine was a vasodilator, but this is a vasoconstrictor. It actually constricts the vessels. Now the lipid mediators. Prostaglandins and cytokines are produced by arachidonic acid present in membrane phospholipids. Like these are the ones which are principal actions. These are actions produced by this. These are the ones which are produced by this arachidonic acid pathway. I'll tell you. Like see, this is a pathway. Like complete cell membrane phospholipid. These phospholipases act on this, and arachidonic acid is produced. And this leads to this cyclooxygenase and lipooxygenase. These two pathways are there, which will lead to formation of this leukotriene C3, C4, D4, E4, and then lipoxin A, B4. Then this cyclooxygenase pathway, this will lead to formation of prostaglandin I2, thromboxane A2, then PGD2, prostaglandin D2, prostaglandin E2. And these are the ones. So, what are the functions of this? These actions of these molecules, like prostaglandin I2, E1, PGE2, and PGD2. This causes vasodilation. Now, vasoconstriction is caused by thromboxane, leukotriene C4, D4, and E4. And vascular permeability is increased by leukotrienes D4, C4, D4, and E4. Like and chemotaxis and leukocyte addition. It is caused by leukotriene B4 and HET. This HET is hydroxy-eicosapentaenoic acid. It is produced during this reaction. So these are the ones produced in this LOX pathway. So what are mediators of now cytokines? So cytokines are proteins produced by many cell types, principally activated lymphocytes, macrophages, and dendritic cells, but also by endothelial, epithelial, and connective tissue cells that mediate and regulate immune and inflammatory reactions. And following table summarizes there are cytokines. These are the cytokines which are released by these sources. These are sources, and what are actions? Like these are the actions which are done. This tumor necrosis factor. It is released by macrophages, mast cell, and T lymphocytes. It stimulates expression of endothelial adhesion molecules and secretion of other cytokines and systemic effects. Interleukin 1. As I told you in the beginning that interleukin 1, this is responsible for fever, and it is released by macrophages, endothelial cells, and some epithelial cells. So it is similar to TNF but greater role in fever. So interleukin 6, it is released by macrophages and other cells. It has some systemic effects and causes acute phase response and chemokines. It is released by macrophages, endothelial cells, T lymphocytes, mast cell, and other cell types. It causes recruitment of leukocytes at the site of inflammation, migration of cell in normal tissues. So these are the ones which are actually produced in the acute inflammation phase, and these are the ones which are produced in chronic inflammation phase. So these are mostly interleukin 12, interferon gamma, interleukin 17. Interleukin 12 is released by dendritic cell and macrophages. It causes increased production of interferon gamma. So interleukin causes release of interferon gamma, and interferon gamma, it is released by T lymphocytes and NK cells. It causes activation of macrophages that increases the ability to kill microbes and tumor cells. So interleukin 17, it's produced by T lymphocyte. It causes recruitment of neutrophils and monocytes at the site of inflammation. So these are the effects of these cytokines, like interferon, tumor necrosis factor, interleukin 1. This increases the permeability of vessels, and this leukocyte activation, this TNF1 and interleukin 1 does. And then there are some systemic protective effects, like in brain, this TNF1 and interleukin 1 and interleukin 6. Like it goes in the brain and stimulates brain, which rises the threshold of body temperature. So it causes fever. Like fever is not the one which is very harmful. It is actually a protective effect that is the response of the body to the, like, it is the measurable response which we can measure from outside for the ongoing, like some degree of inflammation or some infection or something is going on inside the body. It is a symptom for that thing. And interleukin 1 and interleukin 6, this releases the acute phase proteins from the liver and the bone marrow. It causes leukocyte production. It increases the production of these leukocytes, like we say that lymphocytosis or leukocytosis patient is having, so it is like TNF1, interleukin 1 and interleukin 6 which causes that. Then systemic pathological effects, like in heart, TNF causes low output, and then thrombus production, it increases with permeability. TNF alpha, it leads to thrombus production. And multiple tissues like skeletal muscles, TNF and interleukin 1, it causes insulin resistance. So it can produce diabetes in the, due to this interferon 1, tumor necrosis factor 1 and interleukin 1. It can produce these diabetic-like features due to insulin resistance. So chemokines are the family of small 8 to 10 kilodalton proteins that act primarily as a chemoattractant for specific types of leukocytes. What are the role of chemokines? In acute inflammation, it stimulates leukocyte attachment to endothelium, and it also stimulates migration of leukocytes. Like I showed you in this, the vessels like diabetes, the neutrophils was coming out. So it causes this stimulate that release of this neutrophils and all at the site of inflammation. So it also causes this maintenance of tissue architecture. Some chemokines are produced consecutively in tissues and are sometimes called homeostatic chemokines. Like it produces a homeostasis, like it produces like homeostasis of one, like continuous same environment in the body. It will try to produce that. These organize various cell types in different anatomic regions of the tissue, such as T and B lymphocytes in discrete areas of spleen and lymph nodes. So now complement system. This system is a collection of small soluble proteins and membrane receptors that function mainly in the host defense against microbes and in pathologic inflammatory reactions. The system consists of 20 proteins, some of which are numbered from C1 to C9, like C1, C2, C3 till C9. There are some of these things which are very important. And complement proteins are present in inactive forms in the plasma. Like I told you, these are present in inactive forms. And if there is inflammation and all, then immunoglobulins are the ones which are actually activating this complement system, which actually means help them to control the infections. The critical step in complement activation is proteolysis of the third component. So actually the most important thing is like C3. It has to be broken to C3A and C3B. And C3B is the one which is actually continuing the reaction. And this is the most important step which actually happens in this complement fixation, like complement activation. So there are three pathways occurring in this complement system, like alternate pathway, classical pathway, and lectin pathway. These all will go, and their ultimate aim is to break C3 into C3A and C3B. Then C3A is actually the one responsible for destruction of inflammation. It will cause activation of leukocytes, which will probably control the infection. Then the C3B, it will help in phagocytosis. It will produce, it will express some receptors for the macrophages to engulf this bacteria along with this C3 molecules. It will help in destruction of these microbes. And then C3B are the one which is responsible for formation of MAC, like membrane attack complex. It will help in the this is a bacteria, this is the bacteria, and this MAC will form, and it will settle on this bacteria, and it will produce some hydrolysis enzymes which will destroy its membrane, outside of the body, outside of this capsule. It will destruct it, and it will lead to release of all the internal materials, and it will cause the destruction, lysis of the microbes. So there are some complement deficiencies and diseases which are related to one, like C1 INH, hereditary angioedema, overproduction of C2, C2B, and C1, C2, C4, like predisposition of SLE, and these are the mechanisms which are how this are actually done. Then these are the classical pathways which are activated, they start from C1, and alternate pathway like factor B and D, C3, these produce some bacterial infections and these things. So factor H and I, these are important ones which causes C3 deficiency and susceptibility to bacterial infections. So what are the morphological patterns of acute inflammation? So there's serous inflammation, fibrinous inflammation, purulent inflammation, and ulcers. So these are the morphological patterns which are actually patterns are formed in this inflammation. Let's go to serous inflammation. Like we can see, there is a skin blister. This is the blister formed just below the epidermis. And it's actually dividing the epidermis in these two layers. The skin blister resulting from a burn or viral infection represents the accumulation of serous fluid within or immediately within the damaged epidermis of the skin. Like if this is the damaged epidermis, just beneath that there will be fluid accumulation, and then there will be recruitment of the neutrophils. Is the acute inflammation, so neutrophils will come and take part in this inflammatory process. So you can see there are a lot of this neutrophils and all accumulating in this area. So it usually occurs I told you, this inflammation, this acute inflammation, there is a leakage in the vessels, there is vasodilation, and there is endothelial contraction and all, which leads to movement of this neutrophils and all to outside. So this will lead to this inflammatory process. This is the serous inflammation. Now, what is fibrinous inflammation? If there is more if there is more distinct form, gap is more in the vessel wall, like endothelium, then this fibrin materials which come out of the tissue, it will get deposited. It will get deposited from the vessel into the tissues. See this pink material; these are the fibrinous tissues which are deposited. So it will. So this pink these areas you can see, these are the ones which are fibrin deposits in this. In the pericardium, and pink meshwork of fibrin exudate is overlying the pericardial surface. See, this is the one which is fibrinous inflammation, and if this fibrinous inflammation continues for longer, it can cause fibrosis of this organ. So it will lead to permanent damage of the organ. Now, what are purulent inflammation? It's abscess formation. After the infection. After any infection is there, then this occurs after bacterial infection. This serous fluid and all, it will lead to destruction of the tissue, as well as there is some recruitment of leukocytes. So these are the ones which are present in abscess. Like there will be fluid, there will be proteins, degraded proteins, cells, and then it will be like neutrophils and leukocytes, and these things will be accumulated. So multiple bacterial abscesses, like this one, even this one we can see, this one we can see. These are the ones which are formed as an abscess, and in this area we can see there is so much of inflammation and neutrophils accumulating here, and it causes a lot of destruction in the cells, and there is congestion of blood vessels. Like these are the blood vessels, we can see the congestion around this. So these are the congested blood vessels, and this is the one which is inflammatory abscess formation. So now let's see ulcers. Now ulcer is the break in the continuity of the epithelium. There's a continuity in the epithelium. If there is a break in the epithelium, that is called an ulcer. So it is a local defect or excavation of the surface of an organ or tissue that is produced by the slowing of inflamed necrotic tissue. So ulcers are best exemplified by peptic ulcer of the stomach or duodenum, in which acute and chronic inflammation can coexist. Peptic ulcer, like we used to say, there's pain abdomen and person having gastritis, and then this gastritis, if it continues for long, it will lead to ulcer. And then there's person is continuously having this acute and chronic inflammation. So it can coexist together, like acute and chronic. Like we say, acute on chronic. Like chronic, it was continuing for a long time, but suddenly acute inflammation also took over to it, and it will lead to chronic, acute on chronic inflammation. And during the acute stage, there is an intense polymorph infiltration and vascular dilation in the margins of the defect. And with chronicity, the margins and base of the ulcer develop fibroblastic proliferation, scarring, and accumulation of lymphocyte, macrophage, and plasma cells. So this chronic inflammation can lead to fibroblastic proliferation, then it can cause scarring, like scar tissues formation and accumulation of lymphocytes and macrophages. So this is the ulcer. See, this is a break in the epithelium. You can see it is a duodenal ulcer, and in this low part we can see this break in the epithelium, and this. Yeah, and we can see the exudative base in this lower part, and this is the one, and so this probably this is the ulcer created, and this is the inflammatory exudate in the base. So this is the duodenal ulcer which is formed after this chronic ulcer, like peptic ulcer in the duodenum. So what are the outcomes of acute inflammation? Like what all things can go over after acute inflammation? So there is vascular changes and neutrophil recruitment and mediators. This is the acute inflammation which occurs like after infection or bacterial infection. So like in the perfect world, they say it can lead to resolution, like completely normal tissue, which actually rarely happens. It generally doesn't happen so easily. So it can resolve completely, or it can go to pus formation and healing, which will further cause fibrosis. So this acute inflammation can form the pus, and then it will cause like fibroblastic proliferation and all, and it will cause the healing, and then it will lead to fibrosis and loss of function, like that organ will stop functioning. And then acute inflammation can directly go without abscess formation to healing phase, and then it can cause fibrosis, or it can progress to this chronic inflammatory phase, in which angiogenesis means more of new vessels will be formed, and then mononuclear cell infiltrate will be there, like lymphocytes will come in the chronic inflammatory phase, and then fibrosis like scar formation and all will be there. So I told you in the beginning that this chronic inflammation is more destructive than acute inflammation because of this loss of function after formation of this fibrosis and all. So I think this is the acute inflammation which was completed. So this chronic inflammation I'll take in the next class. This won't be continued now. So I'll end it up now. So thank you everyone.
Thank you, sir.
Thank you, sir.